Dr. Kano Obasi, and I'm from Lee's branch of the Overseas Fellowship of Nigerian Christians. It's nice to have you guys here. No. And I've been given the task to speak on the common health symptoms that men should not ignore. And the objectives of this talk is not to frighten anybody, but to empower you with the necessary knowledge that you need so that when you encounter these common health symptoms, you will know what to do. I'm also going to discuss a case study. Go ahead to discuss the life expectancy, health-seeking behaviors, diseases, and deaths in men, and then we'll summarize. I've been given 20 minutes for this talk, and obviously, for most of my medical colleagues here, this can take us days to discuss, but I'm going to discuss within the time limit. Sorry, I think I've given you people expo. I would like Bro James to tell me one of the common health symptoms that men should not ignore. Chest pain. Any other one? Yeah, any other one? Okay. Any other one? Okay. Any other one? From the back, please. Yes. Okay. So, like I did say before, the talk is not to frighten anybody, but to empower you with the knowledge. So, chest pain, as most of us have witnessed it in the past, there are different types of chest pain, and there are different causes of chest pain. But there are some certain chest pains that we don't have to take for granted. If you start noticing a left-sided chest pain, which is quite severe in nature, it might be heaviness. But this chest pain, moving to your jaw or moving to the left arm, it might be associated with increased shortness of breath. It might be associated with your heart racing, what we call palpitations. It might also be associated with nausea and vomiting. You don't have to take this for granted. You have to seek medical attention. Chest pain might also be catching your breath, what we call pleuritic chest pain. It might be associated with chest infection or pneumonia, or it might be due to a blood clot in your lungs. You need to seek medical attention. And shortness of breath. It could be that somebody is unfit, you become short of breath, or it might be a symptom of anemia in the body, or it might be due to some other lungs or heart disease, lung disease like asthma, heart disease like problems with the valves in the heart, or problems with heart failure. You need to seek medical advice. Somebody might start losing weight intentionally. You want to become, look well like myself. So you start losing weight. That's what we call intentional weight loss. But when you start losing weight, without any reason, and it's not because you are working very hard, trying to be fit. It might be due to different causes. It might be due to malabsorption problems. Your intestines are not absorbing the nutrients very well. Or it might be due to some other illnesses like cancer, or it might be due to diabetes. And most of these illnesses are treatable. So you need to seek medical attention early. Dizziness is another common health symptoms that we should not neglect or ignore. Dizziness could be due to dehydration, or it might be due to a sudden drop in your blood pressure. And it might also be related to brain issues, like what we call posterior circulatory infarct or stroke. So you need to seek medical attention. It could also be due to a heart problem. So frequent heartburns might be due to heavy meals, or some people call it indigestion. You know, when you eat loads of akpu, you know, heavy meals, you can have indigestion or heartburns. But at times, it might not be due to that. It might be due to what we call acid reflux. A small group of people with acid reflux can progress to have gullet cancer. So you need to seek medical attention. Somebody did mention about blood in the poo or stool. Discoloration of our poo or stool might be due to something you've eaten, or it might be due to some medications you are taking. But it might also be a more serious problem like bleeding in the gut. So you need to check it out, because it can lead to a more serious problem. Constipation can be, some people can have occasional constipations, but a chronic constipation can lead to other problems like piles. And constipation can also be a symptom of a more serious problem like a partial blockage of the bowels. It can also be due to a tumor or a cancer in the bowel. So we need to check it out. It's advisable for men to palpate or to check their testicles at least once every month. Feeling of your testicles for any lumps is very advisable, and most of the lumps in the testicles are not cancerous, and it tends to occur within the people that are between the ages of 15 and 49. And most of these lumps, like I said, because they are non-cancerous, they can easily be treated. And even if they are cancerous, they are the type of cancers that are easily treated once it's caught early during this course. So don't feel embarrassed. See your GPs and get it treated. Impotence, what we call erectile dysfunction, could be a sign of stress. It can also be due to underlying problems like depression, or it can also be an early sign of a heart problem, because the blood supply to the heart is larger than the blood supply to the penis. So what tends to happen is that if there is a problem with the heart, it tends to manifest first in the penis. So you have impotence. It can also be due to some medications some of us are taking. But the good thing about impotence is that it can be investigated and it can be treated. So early seeking medical help is very advisable in this case. You can see the young man with the wife, they're very frustrated because he cannot do his jobs or duties. Blood in the urine is another problem. This could be due to an infection in the waterworks. It can also be due to a problem with the prostate. It can even a common prostatic enlargement, or it can be also a problem with the prostate cancer. It can be a problem with the kidneys or the bladders, and discoloration there also might also be due to what we've eaten. If you know that you've eaten beetroot, it might change the color of no. But if you know you've not eaten that and you are passing this water that is colored, at times it might be associated with some pain or burning sensation while passing urine. So you need to check it out. Trouble urinating. If you have a weak flow of your urine, dribbling while urinating, or straining while urinating. No, that might be an early sign of prostate problems. Most of the black people also have prostate issues, especially when you are above the age of 40, like some of us. So you need to get it checked out. And I did mention that when you are having some burning sensation while you are passing urine, it might be a sign of water infection. Frequent urination could be due to an overactive bladder. It might be a typical symptom of diabetes. If you are waking up in the night to go and urinate, it might be due to maybe medications you're taking. It might also be due to a heart failure, or it might also be due to prostate problems. So you need to check it out. Excessive thirst. You can see this young man, very thirsty. It might be due to simple dehydration. You've worked very hard and you are getting, you are dehydrated, or it might be the weather too hot. Men are being advised to drink at least 2 liters of water in a day. It might also be due to an early sign of diabetes or high levels of calcium in the blood. So get it checked. Feeling low in mood, sadness, low interest in the normal things that your normal hobbies. Early morning awakening, you better check it out. Tiredness might just be that you've not been sleeping very well, physical exhaustion. It might also be due to early signs of diabetes. You need to check it out. Excessive snoring. Most of our people know. It might be that you're obese. It might be that you've drank a lot of alcohol. You're just snoring away. And most of these people, it might also be due to a more serious thing, what we call sleep apnea, due to the weakness of the muscles around the throats, which is causing a partial obstruction of the airways. Most of the people suffering from this, they don't know that they've got it, but their partner, you can see, they couldn't sleep because of this snoring episode. The problem with this snoring, you might say that it's just a simple thing, is that it can lead to hypertension or irregular heartbeats. And irregular heartbeats, in turn, can lead to strokes. So you have to check it out. Changes in the color or in the shape of some moles can also be due to skin cancer. I'm going to be running as fast as possible because I've got loads of things to say. As we're getting old, our vision, becomes a bit obscured or impaired. That's not a problem. But when you start seeing some tunnel visions, seeing some blind spots, or seeing some halos, it might be due to cataracts or glaucoma or what we call macular degeneration of the eye. It could also be a sign of migraine or stroke, and it could also be a sign of a brain tumor. So you need to go and get it out. Memory loss, as we're getting old, we tend to forget things. But when you start forgetting things, quite commonly, mixing up words, if you want to say bread, you are saying a cheese. And even the common things that you should say, it might be an early sign of dementia, so you better check it out. Persistent cough. You can have a cough for a week. It might be due to common colds, but if you start having a persistent cough for more than 3 weeks, it might be a sign of a more serious thing, like lung cancers, tuberculosis, from our background. Swellings in the big toes might be an early sign of gout. Gout is caused by the inability of our kidneys to secrete what we call urate crystals. They can accumulate in our large joints, the big toes, and cause a pain and stiffness there. So it's a treatable condition. Seek medical attention. I'm going to present a case study like I did say. It's a case of a 37-year-old gentleman who is usually fit and well. He's a non-smoker, does not consume alcohol. He's married with 2 children. He's got a family history of diabetes and prostate cancer. He presented to his GP with a 2-day history of urinary, going to toilets so frequently, no burning sensation while passing urine, no discharges or any fever. He did not have any other problems, general problems. He denied any extramarital contacts. On examination, he looked well. His blood pressure was about 168/95. His heart rate was 76 beats per minute. Examination of his chest, abdomen, and central nervous system were unremarkable. The laboratory test didn't show any abnormalities with his urine test, but his blood test showed the high levels of glucose. The bad cholesterol was high, and the good cholesterol was low. What is the diagnosis? Can we all shout it out? Diabetes. This patient has got diabetes. And management of diabetes is mainly in the control of the blood sugar, prevention of hypoglycemia, low blood sugar, prevention of diabetic complications. So in the control of blood glucose, we tend to give them lifestyle advice, reduce on the amount of sugary food that you eat, and do more exercises, aerobic exercises. If this doesn't control that, we give some medications. The medication can be in form of tablets or injectables in the form of insulin. Prevention of low blood sugars, hypoglycemia we call it, needs your blood sugars to be monitored. Prevention of diabetic complications is very, very important. It's the key in the management of diabetes, because most of the people live without diabetes, knowing that they've got diabetes. But the complications could be largely divided into what we call microvascular and macrovascular complication. Don't fear, I'm going to tell you what they mean. Microvascular complication is the fat clogging the small blood vessels in the eyes, causing eye problems with diabetes. They can also clog the blood vessels in the kidneys, causing kidney-related problems with the diabetes. Or the small blood vessels supplying the feet, causing a numbness in the feet and also in the hand. Then the macro complications, macro means big, as we know it. The large blood vessels in the brain causing strokes, in the heart causing heart attacks, and in the legs causing some ulcers. And ultimately, a person can die because of diabetes complications. Then life expectancy is increasing globally in both men and women. And this could be partly explained by the advances in healthcare systems and the treatment options available to everybody. And women tend to live longer than men, as we all know. And this gap is about 5.3 years. And it could also be explained partly due to the problems with men seeking health care. About 32% of men, the consultation rate for men is about 32% lower than that of their women counterparts. And a survey which was conducted on behalf of the Blue Ribbon Foundation. Blue Ribbon Foundation is a charity organization that deals with men health initiative. It showed that about 1 in 5 men have not seen their GPs in the last 12 months. And more worrisomely is that 6% of men don't even see their GPs, despite having severe chest pain. And that might explain why most of them don't seek medical emergencies. About 100,000 men die prematurely in the UK, mainly because of ischemic heart disease. And ischemic heart disease occur in men in all ages than women. And this is a leading cause of death. Okay, that's fine. So I've managed to explain the common health symptoms that men should not ignore, and we did discuss that whenever you have all these symptoms, you better seek medical help. We also discussed about the case study of a patient with diabetes mellitus. I tried to discuss about life expectancy, health-seeking behaviors, deaths, and illnesses in men. Thank you very much for listening.
Thank you very much. Okay. Very quickly, I'll just ask regarding health. Some time ago, I organized a cycling exercise for the Men's Fellowship in Newcastle, and one brother sent a link correlating cycling to prostate cancer. So can you elaborate on this, if there's any link at all?
Sorry, my brother, when you say linked with it, is it as a cause or as a cause? I'm not sure. I've not seen anything linked with that. I'm a physician. I'm not a urologist. But I don't think that there's any link between the two.
I'm a GP. I have read so much on prostate cancer. I've never come across cycling causing prostate cancer. The nearest is that it might increase your PSA because it causes anything that, if I stick my finger into your rectum, it's going to increase your PSA. So PSA on its own, it's not an indication of cancer.
Do we need to wait for these symptoms to manifest before we do something about health?
Obviously, most of us that you have some annual health checks with your GPs. But you can't tell me that you go to meet your GP when you don't have any blood in your urine that you are complaining, you've got a complaint like that. So you attend your annual health checks, and when you have any of these symptoms, you seek early medical help, because early diagnosis leads to a better outcome of any illness. Thank you.
Thank you. Questions. It's more of a comment, really. But obviously, what do you do when you have that chest pain in the middle of Ajegunle in Lagos? Well, you have to be global these days. Okay. I think the quick answer is, there are many apps developing now, and I think one member of OFNC will come and address us one of these days. The telephone apps and the smartphones are actually very helpful to know what you do, even in Nigeria, because there are some help out there, from Google, also from your mobile phone apps. Thank you.
So it's important you have health insurance when you are traveling to Nigeria. It's very important, because a lot of people have run into problems when they were in Nigeria. And recently, somebody's wife went to Nigeria, developed intestinal obstruction, and had to be operated on. They had to use a helicopter to fly her back to the UK because she was almost dying.